2 to 5% of people over 60 suffer from chronic atrial fibrillation. Without anticoagulation therapy, their annual stroke risk is 4 to 5%. As many as 1 in 5 stroke patients are found to have atrial fibrillation. Preventing stroke as a result of this common arrhythmia is thus of central importance. This patient has chronic atrial fibrillation. Echocardiography reveals the almost complete lack of contractility of the auricle. Here we can see how the stagnant blood flow has resulted in the formation of a thrombotic mass. A transesophageal view clearly shows a large thrombus in the left auricle that may break free at any moment. The irregular beating of the heart in atrial fibrillation creates the ideal conditions for thrombus formation in the left auricle, especially in patients with mitral valve insufficiency. Fibrin forms rapidly in stagnant blood. The formation of the fibrin threads that are the scaffold of the thrombus can be seen in this unique sequence filmed through a light microscope. Thrombin plays a pivotal role in the polymerization of the fibrin strands. Red blood cells become trapped in the fibrin network as the thrombus grows. As the size of the thrombotic mass increases, it becomes more of a threat. Especially if the heart rate is normalized, fragments of the thrombus may break free to be swept into the circulation. Small fragments may lead to a transient cerebral ischemic attack. Larger pieces may have more devastating consequences. Let's follow the fragment as it's carried past the crevices and valves of the heart. The consequences of this journey depend on where it finally lodges and are often sudden and dramatic. 25% of the blood flow from the heart is pumped to the brain. Cerebral thromboemboli most frequently affect the middle cerebral artery. The patient's symptoms generally develop during the space of seconds or minutes. The damage to the ischemic area of the brain can be followed in this series of CAT scans made during the first 24 hours. Our patient has suffered from a major stroke with symptoms affecting the right side of his body. When thrombi form in the heart as a result of atrial fibrillation, the consequences can be devastating. Currently, only 4 of 10 of those who need anticoagulant prophylaxis are treated. This is due to anxiety about the side effects, numerous drug interactions, and frequent testing involved in traditional anticoagulation therapy. Consequently, the thromboembolic complications of atrial fibrillation, notably stroke, unnecessarily continue to claim lives and cause disability. Identifying patients with chronic atrial fibrillation and offering effective antithrombotic therapy can prevent many cases of thromboembolism and save lives.